Hi, this is Bob Roth, Managing Partner and Co-founder of Cypress Homecare Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Homecare Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Noon, you're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We're also coming at you via podcasts. That's something kind of new for us, and we're glad to bring this to you in all different shapes and sizes of mediums. If this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening here to Health Futures, not to me, but to these extraordinary guests that I get to come to the show. So today is no different. I have an extraordinary guest that just flew in from Austin, Texas, by way of Israel, and I'm really proud to have her here in the studio with me. I have Romi Gubes here. She is the CEO of Sensi AI. Welcome to the show, Romi.
Thank you, Bob. Thank you for having me here.
It's good to have you here, and I have this partnership with you, and the partnership is really to deliver exceptional care, better care for our older adults. And, for our listeners, I would love for them to really understand a little bit about Sensi. And, I will tee this up by saying that I've talked about it here on the show. The biggest challenge that we have today is finding workers, and workers that are caring, compassionate people. And I'm going to take this opportunity to make this appeal to our listeners. If you know of somebody, or you are that person that has that gift of helping people, we're looking for great caregivers at Cypress. So please give us a call at 602-264-8009, or go up to our website at cypresshomecare.com. You can apply right there online, and you can join our extraordinary team. But knowing that we have really challenges relative to our workforce, I believe Sensi has developed a great solution to help care for older adults. So did I do a good job teeing this one up?
Yeah, perfect.
All right, so I'm going to let you take it from here to really tell us a little bit about Sensi and how you are certainly assisting and helping agency owners like me to deliver high-quality care to our older adult population.
Yeah, perfect. I think it's a good segue to speak about what Sensi is doing today. So Sensi AI is a technology company, a startup company that was built 4 years ago, actually out of unfortunate experience that I had with my daughter at daycare.
I don't think I knew this. So
yeah, this is a brand new information.
Wow, I'm really excited to hear this.
Yes, so before Sensi AI worked, I am a software engineer by training. I worked at several Fortune 500 companies until today, Cisco, Dell EMC, and Vonage. But I always knew that I will establish my own company one day. It was a dream of mine. Just didn't know, what is the right mission to fight for. And then 4 years ago, I had an unfortunate experience with my daughter where we discovered a really bad case of abuse in the daycare center where she was. We believe nothing really major happened to her. We took her out of there pretty quickly. We realized that something is wrong. We had this, this parent gut feeling. But when it happened, we really understood that something has to be changed. And diving into this world of vulnerable population, starting from kids, but then, going to people with disabilities up to older adults, we understood that I fell in love with this industry and with this huge room for disruption. We really realized that we're in an inflection point in the in the population, right, in history, where if nothing were to happen, neither of us, our parents or us, won't get the sufficient amount of care that we need out of lack of potential caregivers. And what we aim to do until today is to provide this full transparency into the homes of those people that cannot always speak for themselves, and to provide you as a home care owner, as the provider, with full understanding or the most comprehensive understanding of the changing needs of the older adult at home. So we started out by, having this unfortunate experience of abuse, but those are edge cases, right? And we're far from being just, a gotcha tool. We were trying to become the most comprehensive, as I said, and predictive tool for you to detect trends early on and to react in real time to prevent the next escalation from happening. Just to bring it a little bit, down to earth. So we're discovering, our solution today is discovering things as early signs of UTI, medication errors, all kinds of emergencies like falls, calls for help, EMS activation, then pain management issues, any kind of caregiver-client match, unsatisfied clients, lack of specific training, and I can go on and on. We have more than 100 different types of insights and notifications that the system discovered today.
So can we do a deeper dive into the system? Because, I think for our listeners, visualization is always really good because we're not on the cameras and we can't show, videos. Can you describe a little bit about Sensi and how does it do all of that? I know, but our listeners don't really know, and I think that would be really good to hear. And also, the artificial intelligence piece. And I understand enough to be dangerous, but AI is all about patterns, and discovering disruptions in those patterns is really what will discern those 100 different types of things that could be happening in the home.
Right. So obviously this is a very challenging task to understand what's going on in the home.
Right.
And it's becoming more challenging when you're speaking about older adults rather than other, types of population, because all kinds of different parameters that they experience in their own homes. And I will get into that maybe a little bit later. But as of today, we are a company of about 60 employees. We're 3 co-founders. We have our site back in Israel that is mainly around R&D and AI. And we have our team here in the US, our go-to-market team that are working with our clients, our home care agencies. And what we're doing is we're actually providing an audio-based solution where the audio came out of the trying to think what is the right balance between privacy intrusion, but then also valuable data. So we didn't want to go into placing cameras in the homes. It's from the one hand visuals providing with tons of data, but then again, putting it in bathroom, toilet places, and bedrooms, places that are pretty intimate.
Mm-hmm.
We felt it's not the right solution.
Right.
Then we went down for audio, and actually it exceeded all of our expectations in terms of how valuable audio can be. So as of today, we are providing these audio pods to those agencies that are going and deploying the audio pods in the homes of the older adults. It streams the audio 24/7 to our HIPAA compliant secure cloud. This is where the audio goes through a processing process. Mm-hmm. And with the help of our models, our AI models, we're able to produce those insights that I shared before. We're starting out by building a baseline to each and every older adult because you saw one older adult, right? Each of them are aging differently.
It's like a snowflake.
Yeah, exactly. You can think
Not that you see any in Austin, and neither do we here, but I get it.
But, there are people with hearing disabilities that might speak louder or less fluently. There are people that are watching TV on very loud sounds, all kinds of different infrastructure to the homes that are changing the acoustic in the home. So we're creating a baseline for a specific home. And then also this is how we learn the routine in a home of an older adult. So just to give an example, if we're speaking about UTIs, for example, we know that coming out of the norm of toilet use, might indicate a potential UTI, right? So if an older adult, regular use of the toilet would be once, twice, 3 times a day, and suddenly he's starting to use the bathroom 14 times a night, which happens when you have a
UTI. Yeah.
a UTI. This is where it will pick or it will generate some kind of an anomaly.
Well, that's a great way to segue into our second segment. I told you before we got on the air, there are 4 segments. Each one's about 10 minutes long. They go really, really fast. I don't know if you're a fan of Steely Dan. I just saw them about a month ago. They're awesome. So thank you, James, for playing a little Steely Dan.
We went for 10 minutes now?
We're going to a break.
Oh, wow.
We're going to a break, and we're going to come back, and we're going to pick up on the UTI and really dig down deep a little bit about what Sensi can really do as it relates to predicting, not preventing. But prediction is really the key word here. Mm-hmm. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Romi Gubes here in the studio with me. She's from Sensi. She is the CEO and co-founder. Stick around. We'll be right back.
Now back to Health Futures, Taking Stock in You. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Homecare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our second segment here. I got Romi Gubes here. She is the co-founder and CEO of Sensi AI. And just for our listeners, if you want to check out Sensi AI, it's SENSI.ai. Pretty simple. And you know what? You guys are amazing. Just picking up where we left off on the first segment, we were talking about some of the things that Sensi can do for older adults. And you left off talking about, the predictability. It's not the prevention, because you're hoping you can prevent by predicting outcomes. But the predictability of, you were describing a UTI, but I'd like you to dive a little bit deeper into some of the things that Sensi's doing for agencies like me in helping predict outcomes that could be really devastating for our older adult population.
Yeah. I think that most of the things that Sensi is discovering is things that eventually will be discovered. The game-changing solution or the game changer that Sensi is around the early detection. How early can we discover those things? Sometimes Sensi is discovering those things before the older adult is even noticing that he's experiencing such things. So, for example, cognitive decline. This is something that, once it starts or once it escalates, maybe you want to implement all kinds of safety measures in the home to prevent fall, right? When you have this disorientation or confusion, or anything around that, you want to know about those cognitive changes as soon as possible to really react to that and to be able to prevent the next thing from happening. So this is, just one other example. So we're trying to provide this data in a timely manner to make sure the providers can really react to that as soon as possible and reduce our goal at the end of the day is double. First, to reduce hospitalizations and hospital visits to those older adults,
right,
which is huge. And then also to make sure we're increasing their life in their stay-in-home time. So to make sure that they can stay as long as possible in their own homes without going into a facility or, end their life.
So for our listeners, when you poll 65-year-olds and older, 9 out of 10 want to age in place. They want to stay at home. And why not? I mean, that's what they know. That's what they love. They're comfortable there. And by utilizing a solution like Sensi and obviously care like Cypress gives a consumer or an older adult that opportunity to do so. So I want to do a little deeper dive into the tech. Okay, so I mean, these are listening devices. And, you talked about not going cameras, and I get that. And I used to be on the ambassador committee for Aging 2.0, and I think I shared this with you earlier. We did a panel discussion with 150 people with 5 panelists, and 100% of those panelists said, no way do I want a camera in the home.
Makes sense.
My privacy is my privacy. I don't want my children. I don't want some stranger watching me go to the bathroom or sleep or anything like that. So audio devices make a lot of sense. So my question to you is that you're utilizing a lot of tech behind the scenes, artificial intelligence to discern, what's happening. So for the consumer and for our listeners, are they recording all the audio? And, is there a privacy issue? Because, what if my dad is talking about, investments or, his passcode to his bank account? Those are things that I would be really concerned about.
Yeah. And this is also one of our, main efforts, I would say, to make sure that we're keeping the privacy of the users that are using Sensi. And one of the things we were focusing on is we were focused on at the beginning, is how we're creating models that will pick up only care-related events. And this is what we did in the last 5 years. We have our clinical team on board that is a part of our product team that includes nurses, social workers, PTs, OTs, people that really sat down, listened to our first users across the world, and really tried to create a data set that will later on train the model to pick up only care-related events. So we're not interested in picking up anything other than that, and we're not letting anyone tap into the audio, tap into the data. Although we got some, requests, you can imagine.
Oh, yeah.
Yeah. To special features of like tapping in, listening to what's going on. We decided not to take this approach. We decided that privacy comes first, and we want to make sure that we are keeping the privacy of our clients and picking up only short snippets of between 5 seconds, to 1 minute of a care-related event. Only when things are happening that are actionable, we're picking it up and putting it on the dashboard of our clients.
No, and that's really nice to know. I mean, because privacy is something that's very important to our older adult population because of some of the things that I described that could happen.
Yeah.
So it's interesting. Okay, so you gather all this information, and for a home care agency like me, how does that get reported back to me? I know you talked about it, reports and stuff like that. Again, for our listeners, I want to help them visualize this. So if you could, if there were potential UTI or a medication error or a possible fall, how does that get conveyed to an agency, which then gives us an opportunity to intercede or at least contact a family member and let them know what's going on?
Yeah. So first of all, I think it's important to mention that Sensi was built with and for home care owners, unlike many other solutions out there that was built with a business-to-consumer type of approach, direct-to-consumer, where they had in mind the family members as the main users. Sensi, from day one, focused on home care owners and home care staff.
Nice.
We tried to create a solution that will support and integrate in the best way possible to their daily routine. First of all, we know that they're not a 24/7 business, right? They have their own operating hours, and they have some special routine in their day-to-day that will enforce them to use the data in a certain way. And what we did is we actually divided our data into 4 main categories, if you wish. So first of all is like the high-level alerts, things that we need to make sure the agency is aware of ASAP in less than an hour. Things as falls, calls for helps, and EMS activation. Those will get into the dashboard and in a way of like SMS and call or push notification to anyone that is enrolled to the service from the agency side. This is the high-level things. Then we have the needs your attention category. Those are things that, while you won't need to really react on that in real time, it's important for you to know as soon as possible, meaning your next day of work, let's say. Things, as I said, like early signs of UTI, medication errors, things that are involving high risk and needs to be addressed as soon as possible. Then we have the good to know category, where even if you'll get into that segment, once every week, you'll get some very good data out of it that can really improve your operations, but doesn't require timely intervention. So this is where you'll see things as caregiver-client match that you want to maybe react on that. This is where you'll see things as client satisfaction. If the client has all kinds of satisfaction or dissatisfaction from your service, you'll be able to see it there, and many other things. And then the no news, good news category, where this one was actually created because agencies wanted this peace of mind to know that everything is okay with the older adult. And sometimes, when the system is not reporting on anything, it doesn't necessarily mean to them that everything is okay. So we also had this category in place where, those are the clients that everything is fine with them. You can rest assured that things are going smoothly.
Well, that would be one of the ones I would always want to know, right?
Yeah, exactly.
For sure. But at the same time, I mean, when you think about it, and Romi, you and I talked about it this morning, it's a different world we live in today. We are dealing with inflation. The world has changed since this pandemic happened. The cost of care is through the roof. I mean, for the most part, agencies are charging almost 40% more.
Yeah.
And that's because the cost of labor is more. And really, solutions like Sensi and others that are technology driven are great wraparound services for direct care, which is what we provide and so many other agencies do provide. And this is what really gravitated me to Sensi, was they have another, tool in my tool belt to be able to care for somebody when I can't be there to do direct care. Right? So, I mean, that is really the essence of what you are trying to provide for home care agency owners. You hear the music? I tell you, it goes really fast, Romi.
We ended another one.
Yeah, we ended another segment. We got 2 more to go, but
Nice.
but I want to pick up on why the timing of Sensi in our universe, if you will, in this era that we're in right now is so important as it relates to caring for older adults because of that challenge that we have with workforce.
Yeah.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We're at halftime here at Health Futures. Stick around. Romi Gubes from Sensi AI is here. We got a lot more to talk about. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Homecare Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Homecare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you are just tuning in right now, I've got Romi Gubes from Sensi AI here in the studio with me. She's the co-founder and CEO. And if you missed our first half, go up to our website at cypresshomecare.com. Click on the media button. Click on radio show, which is right below that. You'll catch this show and many, many more. So really, to pick up, Romi, where we left off, we were talking about the direct care workforce shortage. It's real, and we're all feeling it. And we're not just feeling it in the caregiving space. Any hospitality space, any retail environment space, we're all struggling. And it's real simple. I mean, we are not having enough people behind us helping people before us. And the math is real simple. In order to keep our population going, every child-rearing female in our country needs to have 2.1 children. And the average right now is 1.7. Maybe even closer to 1.6. So we need to figure out different ways. And you are in a space right now utilizing technology to really assist us in the way we deliver care. When direct care can't be there, we can rely on technology to be there. So I'd love to be able to pick up on where we left off at the end of the first half.
Yeah. No, so I think, this is one of the reasons I fell in love with this opportunity in this industry. I realized, as I said before, that we are in some kind of an inflection point in the history. And I think that at the end of the day, the way I see it is that we don't have enough caregivers, as you said. What it causes is prices going up, right? It has this glass ceiling, but as of today, the prices are very, very high for home care. It leads to a situation where most of the older adults won't get the sufficient amount of care that they need, right? There is a limit to how much you can pay for home care services. And the result for that is people that are staying alone in their own homes with high risk. It causes too many hospitalizations, unfortunately, and it causes the overall cost of care to actually go up. They're going back and forth from the hospital. They're doing all kinds of medical treatments because of all kinds of risk factors that are being not addressed on time. And this is where we see Sensi fits in. We see Sensi fits in to reduce this risk by letting the providers know on any specific risk factor as soon as possible when no one is really there. So not to replace, we're not looking, just to be clear, we're not looking to replace caregivers. We think, Bob and you and I spoke about that. Technology makes things possible.
Humans make things happen.
Exactly.
You got it.
Yeah, so we're not looking to replace caregivers at any point in time. We're looking to complement people,
right?
To make sure that those older adults are actually never alone, and we can support them, and we can let everyone know about their changing needs on time. It's very clear to us, working with hundreds of agencies across the states, that something has to happen. The industry is in a crossroads right now. Things won't stay at the same way they are right now.
They can't.
Yeah.
I mean, there's just no way. I mean, look, I've talked about it here on the show. I mean, long-term care is something that people don't always think about. And it's not exactly a sexy subject to be talking about aging.
Yeah.
But we all need to be thinking about that. And I want to go back to what I said in the second segment. 9 out of 10 consumers 65 and older want to stay at home, and we should give them that ability to do so and be able to bring a wraparound service like Sensi and what you guys have created is really fascinating for me, and really gives me an opportunity at Cypress Homecare to really reimagine the way we deliver care and to be able to create this new model, embracing tech, but not replacing direct care workers, right? It's to enhance that. And we talk about, having it there when direct care workers aren't there, but it's always good to have it there when the direct care workers are there too, because you've got you got a technology there that is discerning changes and patterns, and really, if you want to do maybe even a little bit a deeper dive in what artificial intelligence is, because people are scared of that.
Yeah.
I mean, they really,
I'm scared of that also.
Oh, I know. I mean, let's face it. I mean, most of the younger people that may be listening to this station are thinking about Skynet and the Terminator. I'm thinking about HAL from, 2001 Space Odyssey,
Yeah.
But I mean, Big Brother, listening, share with us what that means in terms of that part of Sensi that makes it work.
So technology, AI is like any other technology, can be used for good and can be used for other purposes as well. What Sensi is focusing on is utilizing the recent developments in the AI field to really make a good change in the world. And it's up to us to control, how we utilize the technology. But at the end of the day, AI is a very simple concept in it. You're taking a model, you're training it on a very large data set to understand what's going on in a specific environment, in a specific data set, in a specific, in a specific, I would say, data type. For us, it will be audio, but it can be any kind of data. It can be text, it can be video. The model gets an input from a specific type, and by being trained over years and over a lot of data, it generates a specific outcome or a specific output from this specific model. And this is exactly what we did. We focused our efforts on building a huge data set that was specifically captured from real life environments of older adults. This is how we created our model. And today, this is how we utilize AI to really build our system. One of the other things we're doing today is we're utilizing all the recent developments of Gen AI. I don't know if you
Oh, I do. ChatGPT.
ChatGPT, Gen AI, everything around that. This is also something that really expedite our developments. It allowed us to really go faster than we did before. For example, one of the models that we are utilizing today is a speech-to-text model, where a part of our data pipeline is actually transforming the speech, everything that is human verbal sounds, into text.
Nice.
And then we're analyzing the text itself in order to understand who said what and how do they feel about that. So also like doing some kind of a sentiment analysis around speech. And those are being, it's not that it wasn't feasible before Gen AI, but with Gen AI, we got higher accuracy rate, lower processing costs, and we were able to really develop our solution faster.
Well, it's interesting. I mean, especially when you have multiple people in a community set or in a residence, right? Discerning on who said what and when, and having, generation AI be able to discern who, this is the resident, this is the guest, is really important.
Yeah. So it was feasible before as well, but again, now we have much more capabilities over there. So it becomes, I would say, leaner in terms of development efforts, and we will see more and more developments that are arising sooner because of those improvements.
Well, what's interesting for me, I'm an old timer in this home care space. April 28th will be our 30th year at Cypress Homecare. Wow. It's hard to believe. We've been around a long time. And, back when the Affordable Care Act came into play and accountable care organizations started to emerge after 2010, a lot of technology companies came in to be, and a lot of the stuff that they were doing was predictive analytics, right? You put enough stuff into a funnel, and you put enough in terms of the profile of the person, right? Caucasian, 85 years old, COPD, CHF, diabetes. You can start to, if you have enough data that comes into that funnel, you can start to predict outcomes.
Right.
And, that's something that they've been doing in healthcare for some time.
Right.
But what's really interesting for me, for a home care agency owner, all of that stuff is more medically driven. You, and maybe I'm wrong on this, you're really looking at the environment. Right. And the individual in that environment and how they are living and how there are changes in that environment. Do I have that right?
Yeah, it's you're totally right. And our goal would be, as time goes by, to become more and more comprehensive and to provide, as I said, this 360 on the life of the older adult. We want you and everyone around the care continuum. We started with home care owners because we believe that home care owners are or home care in general are in the forefront of the aging continuum or the care continuum. But our goal down the line would be to make this data accessible to everyone around the care continuum. So whenever the clinician will want to know something, instead of just speaking with the client for 5 minutes, the patient for 5 minutes, he will be able to log into the Sensi data and see what is going on.
Look at the dashboards and look at patterns and changes.
Exactly.
I don't know if you hear the music.
No.
We're down 3.
Oh, wow.
3 segments. When we come back, I want to talk a little bit more about those dashboards, but I also want to, pick your brain and talk about the future. Because you're in the technology space, and where do you see this type of learning and this type of technology taking us into the next generation?
Sounds great.
You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. I got Romi Gubes here from Sensi. Stick around. We'll be right back.
Now back to Health Futures, Taking Stock in You. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Homecare Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and if you're just tuning in, we're in our 4th segment here. I got Romi Gubes here. She is the co-founder and CEO of Sensi AI. If you missed our first 3 segments, go up to our website at cypresshomecare.com. Click on the media button right below its radio show. You'll catch this one and many, many more. So, Romi, when we left off, we were talking about really the output that you get from the work that these devices, I like to call them virtual care assistants or virtual care monitors, are discerning. You get these dashboards and these reports, and you can, as a clinician, you can review those. And when I say a clinician, you have a clinical team, but I'm talking about the primary care physician for maybe a resident or a specialist for a resident that wants to discern and learn more. Can you describe a little bit to us about these dashboards and what they could see as it relates to patterns and changes in patterns?
Yeah. So we try to, we didn't speak a lot at all about the challenges in adopting new technology when it comes to your daily routine as a provider, right? And I'm not speaking only about home care, but in general, all the different healthcare providers At the end of the day, they live their own day-to-day for tens of years now, right? And suddenly everyone are coming with all kinds of dashboards and technologies and data, and they need to be able to consume this data in an efficient way. And one of the things we focused our efforts on is how we're creating the simplest way of consuming the data. So you won't get all kinds, we're seeing all kinds of technologies that are sharing a lot of graphs, a lot of like different data points that you as a provider need to take and start to analyze yourself. What we are trying to do is actually give you the bottom line. So we are doing the entire analysis and we're providing you those insights after they went through an analysis. So we're not letting you see the
raw data,
or the use in toilet or anything like that. So you will understand that there is some early signs of UTI, if we're going back to the same example. We will figure it out for you and tell you, hey, Bob, Mildred has some potential UTI now. You can advise the family to go and act upon that.
Right.
Yeah. So we're not, as of today, we're not providing graphs at all. We're not providing any kinds of raw data. We're just providing you with those insights. This is our way to provide you with those trends that the system is discovering.
Right. And certainly you're going about it saying, not with affirmation that this has happened. This is a concern. The alarm has been alerted. You need to check into it.
Exactly.
Right? Yeah.
Exactly.
So the pattern has been disrupted, and there's a need to do further analysis or review.
Exactly.
No, perfect. Wow. I mean, it's incredible what you're doing. And, we're helping solve a problem that we've talked about. And that is we can't find enough direct care workers to be able to work around the clock for clients. Clients don't necessarily have, consumers don't have the discretionary income, because many of them live on fixed income, and the cost for care has gone up so dramatically. And for agencies like mine, I've embraced Sensi, and I'm paying for it. And my consumers are not, my clients are not.
Right.
And I'm saying, hey, look, we've created a new model of care, and this is part of our Reimagining Home Care initiative, and we have this wraparound service, and one of our partners is Sensi. And to me, I think it's amazing. I know that the clients that I've brought this into have appreciated that more than the clients themselves, their family members have, because that gives them peace of mind, right? Because so many family members, and we know this from the work that we do over at the Home Care Association of America, that the average adult child is about 280 miles away from their parents. So to have this wraparound service is so advantageous for them, and they so appreciate it.
Right.
Well, I'm going to do, as we get ready to wrap up, just a real quick segment here and just asking you, where do you see the future going? I mean, the future's now, but where do you see it going from here forward?
Yeah. So first of all, when we're looking at the industry, one of the reasons we decided to focus on home care, as I said, is because we believe they are in the forefront of this industry. And when we are serving them, our goal is to make them successful. We want to see our agencies able to serve more clients and to keep them longer at home and eventually see their businesses thrive. This is our main goal with our partners. And in terms of the industry in general, so I think it's all about reducing the cost while reducing the risk at the same time. Today, the prices are too high and the risk is still too big because, as I said, people are not getting the sufficient amount of care that they need. This is why when I'm looking at the industry, I'm looking at some form of fractional care as something that is a must-have, and we will see more and more as time goes by. The ability to provide clients with the exact time that they need without any constraints around, like, what is the minimum shift time that you have to pay for, and without having all kinds of staffing challenges. Just having a consolidated place or concentrated place when you have many clients or multiple clients with one caregiver that will go door to door and give them this, this service exactly when they need it, in a way that will be, on the one hand, very cost effective to the agency, and then also will provide them with exactly the clients exactly what they need in much lower cost.
Well, it's so funny you bring that up because we're actually doing that too. And, you and I talked a little bit about this offline. Since last fall, we've had a couple communities set up where we're doing fractional care, where we're doing care by the minute, not by the hour. But you're right, it has to be in a highly concentrated area where a caregiver can bounce from one consumer to the next or one client to the next and provide care.
And as long as the industry keeps on, the demand keeps on growing and there are more and more, as you said, older adults, I believe that the concentration will naturally become
Well, it makes so much sense. I always use the metaphor, you don't want to take a square peg and try to force it down a round hole.
right.
You want to try to put it in a square hole or put a round peg in a round hole so it fits their needs. I mean, we need to be more consumer focused and really fitting their needs rather than them fitting ours. Having a requirement of 4-hour minimums is real because caregivers want more hours. They don't want less. And during the pandemic, we couldn't find caregivers to do 4 hours. They demanded 6 or 8 because they wanted to see fewer and fewer clients because they were scared that they may get this awful pandemic disease, COVID.
And how bad it is for the clients. If you think about it from the consumer perspective, as you said, like being obligated to pay for 6 hours, even if you don't need it, it's a lot.
It is a lot, and it's a lot of money. So I know we have about a minute or two as we wrap up. Is there a question I have not asked or something you want to leave our listeners with in terms of things to really think about? I know, Romi, I'm putting you on the spot, but
I didn't think about that.
But I should have maybe told you beforehand. But is there a question I haven't asked, or is there something you want to leave our listeners as it relates to tech, Sensi, in terms of what the problem that Sensi's trying to solve for older adults and agencies like mine?
Yeah, I think that all of us need to be less afraid of technologies. We need to all understand that this is a way to really improve our ongoing processes, to improve the way we live today, to make sure we're keeping our loved ones safe when utilizing in the right way, right?
Mm-hmm.
So I think we all need to look at, as you're doing, Bob, and as many owners that are a part of the Sensi network are doing, looking for those innovative solutions, not only in terms of technologies, but also in terms of new business models, new way of operations, really think how we're cracking the code on the next generation of home care to support our community better.
I like that. I mean, we shouldn't be scared.
Right.
We should be embracing this. And you know what? We can put the guardrails in so that we're not scared. Some of the stuff that you're doing, I mean, you're having a lot of machines do a lot of the work for you so that the privacy stuff doesn't get out.
Right.
Romi Gubes, so great to have you here on the show. So great to have you come visit us here in Phoenix, Scottsdale, and I look forward to doing greater things than we are today in our partnership.
Likewise. Thank you for having me, Bob.
You're welcome. Make it a great day. Have a great weekend. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Homecare Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.